Hello, I'm Dr. Tim Hunsaker from Desert Valley Audiology. Today's video is going to be about tinnitus, also known as tinnitus, and that is simply any sound that is heard in the head that there's no external sound created. So many people describe it as a ringing in their ear, a static sound, a hissing, a buzzing. It can even be a pulsatile sound. What is the cause of tinnitus? There can be many causes, and ultimately it's a good idea to have it checked out by an audiologist or by an ear, nose, and throat physician. The most common cause that I see for tinnitus is hearing loss. And the fact that people have hearing loss, the nerve, if you will, or the brain starts to fill in the blanks with some ringing sounds. Also, due to the damage caused to the ear, oftentimes people have those sounds generated in their ears. As I said, it's always best to get a full diagnostic check to see exactly what's causing it. And sometimes we don't know what causes it, but ultimately it's a good idea to make sure that there's no big problems that might be causing it, whatever those problems might be. So let's talk about the treatments for these. You know, if you went onto the internet and typed in tinnitus treatments, you'd probably find a million things, all kinds of herbal supplements, things of that nature that supposedly help. Truth is there's no clinical proof that any of those work. If they work for some people, good for them. But ultimately, there's no proof behind that. When people do have hearing loss, the ideal approach to helping them is a hearing aid. The fact that a hearing aid starts to amplify environmental sounds, it starts to put the environmental sounds louder than the ringing or the buzzing that's created in the head. And I would say for as many as 70% of my patients, once they start wearing a hearing aid, it doesn't cure the ringing, doesn't cure the tinnitus, but what it often does is it makes it less noticeable, makes it less bothersome to them. But also, there are hearing aids out there that have what we call sound generators in them, and so they'll actually produce a secondary sound to help mask out the tinnitus that many people have. So I wanted to show those hearing aids today. This particular one here is made by Resound, and it is called the Tinnitus Solution, or TS. If you were to look on resound.com, you'd find out more about this one. This one here is made by Widex, and it is called, it's the clear model with Zen in it. And what Zen is kind of a unique feature. It actually produces music. So when the tinnitus is overwhelming, people will reach up, push a button, or you can have a remote control, and you push a button, and the Zen will actually play music. So you have a choice of up to 5 different sounds. It's bells are some of the sounds, others are a white noise, and then there's also just kind of a static sound. The Resound is a little different, same basic principle as far as when the tinnitus becomes too much or overwhelming, you can actually turn on the sound generator also by pushing the button or using a remote control. Where it differs is it actually uses, it's kind of a static type sound. And I don't like to use static as a description because that often means it's very harsh. But in this case, it's a very fine noise. It puts it in there gently. And you have many options. You can actually turn it up with the volume control so that the static is louder or softer, or we can actually set it so that it fluctuates and it goes up and down. And again, these aren't cures for tinnitus, but they often do help people, and they find that it is soothing. For other people, they say, you know what, that sounds kind of bothersome, and they don't like to use it. And so in that case, we just recommend a hearing aid in general, and oftentimes people will notice a reduction in how much they pay attention to the sounds generated from their ears or from their head. Those are some of the options, but again, as I've stressed before, ultimately, tinnitus can be caused by many different things, and ultimately it's a good idea to have it checked out by an ear, nose, and throat physician or by an audiologist. Here at Desert Valley Audiology, we're quite proficient in dealing with this. So again, have any questions, feel free to give us a call or visit our website. Thank you. Bye.